Okay, so we're going to talk about pediatric cardiac disorders, pediatric differences, so differences in between your kid patients and your adult patients. So we talked about with the cutting of the umbilical cord, a little bit with the newborn. With the cutting of the cord, systemic vascular resistance increases, blood flow to the lungs and then to the left side of the heart increases. This stimulates closure of the fetal shunts that we talked about in between the atriums and the aorta and the pulmonary artery, the foramen ovale, and the ductus arteriosus. These usually close shortly after birth, or it may take several hours for that to happen. The higher oxygen levels stimulate the closure. The right ventricle is larger at birth. As pulmonary resistance drops, the right muscle reduces to match the left side of the heart by 1 month of age. The higher systemic pressure causes the left ventricle to develop quickly. Infants' metabolic rate and oxygen requirements double at birth. Their heart rate is high to help maintain their cardiac output. Infants have a greater risk of heart failure because of their immature heart. It's more sensitive to volume or pressure overload. Cardiac output depends primarily on heart rate until heart muscle is fully developed, which doesn't happen until 5 years of age. Infants have less compliance of the heart muscle, so stroke volume cannot increase. So we're just going to kind of group all of it together at first, and then we'll separate the different heart disorders out separately. So make sure we're getting a thorough history. For physical assessments, look at their general appearance. What's their color? What's their skin turgor? What's their, what do they look like? Make sure we get a pulse, blood pressure, respiration rate. Vital sign wise, we may say tachycardia, hypotension, tachypnea, dyspnea from the pulmonary congestion. The child may have weak pulses, cool extremities. They may be sweating or have a pallor color. You may see the signs of respiratory distress if they have pulmonary congestion, such as retractions, nasal flaring, grunting, wheezing, cough, cyanosis, or orthopnea. You may see peripheral edema, ascites, which is the around the abdominal area, neck vein distension, periorbital edema. The child may report being fatigued, having exercise intolerance, or weight gain. Eventually, this all may lead to cardiomegaly, which is an enlarged heart, hepatomegaly, which is an enlarged liver, polycythemia, which is increased hemoglobin levels. So if the child's oxygen levels have dropped low enough, the body may compensate by increasing its hemoglobin level to try to get more oxygen to the tissues. You may notice clubbed fingers if it's been a chronic problem. Children may have hypercyanotic spells or blue spells. You may hear them referred to as TET spells, T-E-T. During them, they have acute cyanosis. Intervention for that is to immediately place a child in the knee-chest position, attempt to calm the child, and call for help. There's a link here if you want to click on it to listen to normal heart sounds versus murmurs. Diagnostic tests you may see done, an electrocardiogram, an echocardiograph, lab tests may be ran. This would point out the increased hemoglobin if it's been a prolonged oxygen deprivation. They may increase their hemoglobin level and have polycythemia. It's defined as a hemoglobin greater than 20. They may also do a cardiac catheterization on the child to actually diagnose heart disorders. And we'll talk a little bit more about that now. So cardiac catheterization, prior to, you want to make sure you do a good interview, get a good history of the child. Make sure you know if they report a recent diaper rash, that the procedure may be canceled. That's kind of the area where they would insert the catheter, so we want to avoid that if they have a current or recent diaper rash. The child's to be NPO for 4 to 6 hours prior to, and know that any medication that's going to be given is going to be based upon age, height, and weight. Post-cardiac catheterization, make sure you're assessing vital signs routinely. Assess the heart rate and the respiratory rate for 1 full minute. That's specific to the children. Complications can include nausea, vomiting, fever, loss of pulse in the insertion extremity, dysrhythmias, or acute hemorrhage. For an acute hemorrhage, you're going to want to apply direct pressure 1 inch above the catheter insertion site. Position the child flat. Notify the provider and prepare for administration of fluids and medications. It says a child underwent a cardiac cath. Post-op, you assess pedal pulses and note they are faint. You pull back the bed sheet and notice insertion site is bleeding. What should you do? Apply direct pressure 1 inch above the catheter insertion site. Position child flat. Notify provider and prepare for administration of fluids and meds. Try to think about your signs and symptoms of heart failure. Remember, some can be asymptomatic. So when you think about left versus right heart failure, of course, they're all going to eventually lead to the other if they go on long enough. But you got to think about your normal blood flow through the heart. So here, again, I'm not an artist, but here's your right side of the heart. You have your vena cava coming into the right atrium. You have your tricuspid valve. You have your right ventricle. You have your pulmonary artery that goes to the lungs. So the blue represents the unoxygenated blood coming back from the body to the heart. It goes from the pulmonary artery to the lungs, to the pulmonary vein, which brings the oxygenated blood back to the left atrium. Goes through the mitral valve to the left ventricle. And then oxygenated blood leaves the heart through the aorta and takes oxygenated blood throughout the body. If you understand the normal blood flow of the heart and that pressure on the left side of the heart is always or should be greater than pressure on the right side, so pressure on the left side of the heart is greater than pressure on the right side of the heart. If you understand this picture and that pressure in the left is greater than pressure on the right, then you should be able to make sense of all your congenital heart defects that we'll talk about in just a second. Also, if a person has right-sided heart failure and blood backs up, where does it go? It goes to the body. So that's where you see your signs and symptoms of right-sided heart failure, such as edema. If the left side's not working and it backs up, it backs up into the pulmonary vein, which leads to the lungs. So you have extra fluid in the lungs that leads to the pulmonary congestion. Signs and symptoms. Left-sided heart failure.